Do you think your child does not hear properly? If so, then you must watch this video. I am Dr. Handa, Chairman Department of ENT and Head Neck Surgery, Medanta Medicity, Gurgaon. Children may have hearing problems unnoticed by parents for a long time. Unfortunately, when discovered, it may be too late to correct or rehabilitate effectively. Early detection is crucial for timely intervention and better outcomes. A normal child, by the age of 1 year, should be able to speak monosyllables like mama, papa, dada, etc. If his speech is delayed, then one of the major reasons for this is not being able to hear properly. So if this is the case, then you should immediately go to your ENT surgeon and get him examined. Sometimes there are other reasons for speech, like there can be a tongue tie, where the tongue does not come out completely, and because of that, it can happen. But hearing is a very important thing. Second, if your child is not responding properly to things like the whistling of the cooker, you calling him from behind, someone calling, doorbell ringing outside, then it is very important to get his hearing tested. Hearing loss in a child can be of two types. One which is treatable and reversible, like having water behind the eardrum. Children have frequent colds. There is a tube between the nose and the ear, which is called the eustachian tube, and the cold that is there in the nose can go into the ear and drain behind the eardrum, which can cause conductive loss. But it is treatable with medicines, and many times this water is taken out and grommets are put in. But there is another type of loss that is a bit more problematic. Sometimes it is by birth. It is a nerve loss, sensorineural loss. Either there is a problem in the hearing organ, the cochlea, there is some damage in it, or the nerve that carries this signal to the brain, the cochlear nerve, has a problem. This type of loss is called sensorineural loss. First, if you feel that, then your ENT doctor will see the ear with an otoscope and will take a decision on whether there is a problem in the child, and if there is a problem, then it needs to be tested as to what kind of loss is there and how much loss is there. And this test can be an audiometry test for children above the age of 5 years, but children who are younger than this will not respond properly to audiometry, so a test called BRA brain evoked response odometry is done for them. The test involves sedating or inducing sleep in the child to determine the type and extent of hearing loss. Treatment follows the diagnosis of the type and extent of hearing loss, and then we come to the treatment part. If there is only water behind the curtain, first an attempt is made to dry it out with medicines. Sometimes that water is removed by an operation and rings are put in the eardrum. These are rings called grommets. They equalize the pressure on both sides and come out on their own after 6 months. But in the case of nerve loss, once we come to know that it is nerve loss, then it is important to quantify how much loss is there. Is it 30 decibels, 50 or 70, or is it a profound loss? And once it is diagnosed, then if it is a moderate or moderately severe loss, say a loss of 60 to 70 decibels, then machines can be given. These machines amplify the sound and make the child hear louder. If you don't do this, even if he has the ability to hear something, he will be left behind in class, etc. He will not be able to hear properly. But the bigger problem is when there is a profound loss in both ears, means hearing is below 80 to 90%, then it is necessary to rehabilitate the child completely. In this context, I would like to say that a child learns to speak till the age of 5, and if he does not listen till then, he will not learn to speak throughout his life. That's why it is very important to diagnose them early, and once we diagnose them with the help of tests, and after that, we come to know that it is a case of profound loss or severe profound loss, then a cochlear implant can be done in them. This cochlear implant stimulates the cochlea, that is the inner part of the ear, and these electrical signals then go to the brain and the child receives sound, and when the child gets sound, he learns to speak. These can be done anytime after 9 months till the age of 5 years. This is a successful thing in today's age, and many children from all over the world who used to go to the deaf and dumb school a few years to 10 to 15 years ago, that is, used to go to the school of the deaf and dumb and stay there for whole life. Today it is possible that by doing this, it can be simulated along with the mainstream. It is assumed that a little therapy would be required when the implant is done, for a few months to a year. After that, when they start listening and speaking, many children go to normal schools. Many children lead a normal life, get married, and do jobs. In order for us to help children with developmental issues, it is imperative to diagnose and understand their problem at the right time and understand their problem and go to a person who can help them, whether it is a doctor, a speech therapist, an audiologist, or a psychologist. They all have a role to rehabilitate these children. And the question is why all this happens? Throughout the duration of pregnancy, which typically lasts several months while the fetus develops inside the mother's womb, there is an increased probability for a myriad of infections to emerge. These are called torch, TORCH, toxoplasmosis, rubella, etc., and at times they can cause jaundice at the time of birth, and that can damage the ear's hearing. Sometimes they are given injections for infections, such as streptomycin, amikacin, and gentamicin, and these infections can also worsen the ability to hear. So there are many reasons and some of them are preventable. So if we are aware that this thing can spoil the hearing of a child, then parents, mothers can take care in advance so that their child does not have to face such problems. Avoiding loud sounds is equally important for children, just as important as it is for adults. Diwali crackers, any machinery that produces a lot of sound, music, and songs in high decibels, all are avoidable. So if you are finding this problem in your child, then seek help immediately, and in many children, they can be helped completely. The treatable conditions can be treated with medicine or surgery. Even for nerve loss, today it is possible to treat them properly and assimilate them into the mainstream. Hearing loss in children requires prompt diagnosis and treatment as it can significantly impact their development. Regular hearing tests for children are crucial, and if any hearing loss is detected, it is essential to seek medical attention promptly to ensure timely and effective treatment.